Hello again. My name is Dr. Ronald Popper, and I am a board-certified sleep medicine specialist and the medical director of the Southern California Pulmonary and Sleep Disorders Medical Center in Thousand Oaks, California. Today I'd like to talk to you about a disorder known as narcolepsy. Narcolepsy is manifest by a symptom complex consisting of excessive daytime sleepiness, cataplexy, sleep hallucinations, and sleep paralysis. All of these symptoms do not need to be present to make a diagnosis of narcolepsy. But when excessive daytime sleepiness and cataplexy are present, the diagnosis can be made clinically. In the absence of cataplexy, a sleep study and another type of study known as a multiple sleep latency test are required to confirm the diagnosis. So what is narcolepsy? So let's look at the components of narcolepsy. Daytime sleepiness can be found in many disorders, such as sleep apnea, periodic limb movements during sleep, shift work. It could be the result of medications or other medical disorders. So daytime sleepiness by itself is not a sufficient symptom to make a diagnosis of narcolepsy. What is cataplexy? Cataplexy is the sudden and uncontrollable loss of muscle tone that it can occur either out of the blue or in response to a specific trigger. The two most common triggers being laughter and anger. But any strong emotion, be it joy, fear, being startled, getting into an argument, even during climax, during sexual activity, any strong emotion can set off this sudden loss of muscle tone. This can be manifest by a complete dropping to the ground, which is the classic textbook form of cataplexy, which is rarely seen, to much more subtle manifestations, such as the sudden shaking of a hand while holding a coffee cup, slurring of your speech, a little blurring of your vision. If you're working on a computer, your fingers aren't moving quite as well as they would ordinarily move. These symptoms can last from literally a few seconds to as long as 20 to 30 minutes. Patients come out of their cataplectic episode often feeling drained, but often they will also be as wide awake as they were just prior to the cataplectic episode. Sleep hallucinations or paralysis are just as the name applies. Patients will have a hallucination, seeing or hearing or smelling an object or sound or sensation that they know isn't there as either they're falling asleep or as they're awakening from sleep. More commonly are sleep paralysis episodes, where again, as the name implies, patients are paralyzed. They're wide awake after they've awakened in the morning or just as they're falling asleep. They're aware of their surroundings, but they are completely unable to move. These episodes also can last from just a few seconds to as long as 10, maybe 20 minutes, and then patients will come right out of it. They are completely benign, although they may be very, very frightening to the patient. Narcolepsy is not as rare as we once thought it was. Narcolepsy is more common in males compared to females, and the peak onset of symptoms occurs in the teenage years. We have seen narcoleptic symptoms occur as young as 5- and 6-year-old children and well into patients in their 30s. Patients who first present with symptoms of narcolepsy after the age of 40 must rule out other sleep disorders first before considering a diagnosis of narcolepsy. And if one takes a very, very thorough history retrospectively, most patients will demonstrate symptoms way back into their teenage years or into their 20s. In children who complain of daytime sleepiness, after ruling out other causes of daytime sleepiness, narcolepsy is the diagnosis until proven otherwise. In years past, stimulants were the only medications that were available to treat narcolepsy, and they only treated the symptom of daytime sleepiness. Today we have many choices in the treatment of narcolepsy. To treat the symptoms of disrupted nighttime sleep and cataplexy, we have a drug known as sodium oxybate or Xyrem. To treat the cataplexy, tricyclic antidepressants are also still used by some physicians. To treat symptoms of daytime sleepiness, we will often use drugs known as Provigil or Modafinil, Nuvigil, also known as Armodafinil, And older medications such as Dexedrine and Ritalin and Adderall are also available to treat symptoms of daytime sleepiness. I hope this video has been informative in helping you to understand what narcolepsy is all about. If you have symptoms that are suggestive of narcolepsy, please go to my website to learn more about narcolepsy, and then either visit your primary care physician or see a board-certified sleep specialist at an accredited sleep center. Thank you for watching this video, and always remember to sleep well tonight for a better day tomorrow.